Hello, my name is Lecesne. This is my PSY101 podcast, and my topic will be on concussions. So, concussions normally is known as CTE, chronic traumatic encephalopathy, formerly also known as dementia pugilistica, and it's a neurodegenerative disease found in people who have had suffered multiple head injuries. Symptoms may include behavioral problems, mood problems, and problems with thinking. This typically does not begin until years after the injuries happen. It often gets worse and worse over time and can result in dementia. It is unclear if the risk of suicide is altered based on feelings. So most documented cases have occurred in athletes involved in contact sports, such as boxing, football, wrestling, ice hockey, rugby, and soccer, for examples. Other risk factors include being in the military, prior domestic violence, and repeated banging of the head in general. The exact amount of trauma required for the condition to occur is unknown. Definitive diagnosis can only occur in autopsy due to your death. Since of 2018, there is no certain type of treatment to cure CTE. And studies show that the rates of disease have found to be about 30% among those with a history of multiple head injuries. Population rates, however, are unclear as of right now, and research into brain damage as a result of repeated head injuries began ever since the 1920s, which at time the condition was known as dementia pugilistica or punch-drunk syndrome. Excuse me. Changing the rules in some sports have been discussed as the means of the prevention. Signs and symptoms of CTE, which occur in 4 stages, generally appear 8 to 10 years after an athlete experiences repetitive mild traumatic brain injuries, so constant blows to the head and all that. The first stage includes attention deficit disorder, as well as like confusion, disorientation, dizziness, and headaches. So kind of like the beginners of concussion. Me being a football player, concussions are actually the number one injury known to a football player besides knee injuries. And like you can't like what they're looking for, So let's see, what's the word I'm looking for? Like trainers, you can't just specify if you have concussion. Like it's up to the athlete to see like if you're okay to continue on. So that's why the first stage begins with confusion, dizziness, or maybe you have memory losses. The trainers will probably come up with questions that will help you determine if you have it or not. Like how many numbers am I holding up? What's today's date? So yeah. Second stage symptoms, like I said, will be memory loss, impulsive behavior, and poor judgment. The third and fourth stages include progressive dementia, movement disorders, speech impediments, sensory processing disorder, deafness, depression, and possibly suicide thoughts. So the third and fourth stage are obviously at the top. Light would be awful to you. Seeing things would be awful. Depression, you just won't have any thoughts of doing anything else anymore. And then obviously the suicidal thoughts are a big no-no at stage 4. The condition manifests as dementia or declining mental abilities, problem with memory, dizzy spells, or lack of balance to the point of not being able to walk under your own power for a short time. And lack of coordination plays a huge factor when the CT is that deep into the stage. It also causes speech problems, like I said, and an unsteady gait. Patients with CTE may be prone to inappropriate or explosive behavior and display paranoia. Paranoia. Currently, CTE can only be definitively diagnosed by direct tissue examination after death, including and whole brain analysis. In lack of techniques to show distinct biomarkers of CTE, CTE is the reason why it can't be diagnosed while a person is alive. Um, if you do it alive, it would probably take a long time to determine it, just like how it's taken a long time for athletes now to determine it, if they have CTE or not. Concussions are non-structural injuries and do not result in brain bleeding as the CTE sometimes does, which is why most concussions cannot be seen on routine tests such as a CT scan or an MRI scan. Symptoms of concussions, that those that occur shortly after an injury, should not be confused with CTE. Differentiating between prolonged and post-concussion syndromes. CTE symptoms can be difficult. Research studies show that they are currently examining whether neuroimaging symptoms can detect subtle changes in integrity and structural lessons that can occur in CTE. Recently, more progress in diagnostic techniques for CTE have been made. However, more research obviously needs to be done before any such techniques can be validated. Um, Biomarkers for CTE is the presence in the serum of autoantibodies against the brain. The autoantibodies were detected in football players who experienced a large number of head hits but no concussions, suggesting that even some concussive episodes may be damaging to the brain. The autoantibodies may enter the brain by means of a disrupted blood-brain barrier and attack neuronal cells, which are normally protected from an immune onslaught. Given the large numbers of neurons presented into the brain, and considering the poor penetration of antibodies across a normal blood-brain barrier when you're hit by another person during the game, there is an extended period of time between the initial hit and the development of any signs or symptoms. Nevertheless, autoimmune changes in blood of players may persist the earliest measurable event predicting CTE. Investigators have demonstrated that immobilizing the head during a blast exposure prevented the learning and memory deficits associated with CTE that occurred when the head was not immobilized. This research represents the first case of series of post-mortem brains from the U.S. military who were exposed to a blast and or concussive injury. Because of that concern, boxing may cause CTE, and there is a movement among medical professionals to ban sports, even football as well. Medical professionals have been called for a ban as early as the 1950s. So bringing it to a football aspect, all of these pictures that you're looking at the screen are head hits, and some of the pictures you see players just completely knocked out, heads to the ground, helmets even off, people grabbing their heads. Beginning in 2002, Dr. Bennett Amalu, who is a forensic pathologist and a neuropathologist in Pittsburgh, Pennsylvania, found a CT in the brains of professional football Hall of Famers just like Mike Webster, Terry Long, Andre Waters, and Tom McHale. Amalu, initially a medical examiner, then associate professor in California, was a co-founder of the Brain Injury Research Institute, and reportedly in 2012 participated in the autopsy of football legend Junior Seau. Amalu's participation was halted during the autopsy after Junior Seau's son revoked previously provided oral permission after he received telephone calls from the NFL management denouncing Amalu's professional ethics, qualifications, and motivation. Amalu just had a movie made on him in 2015. The movie's called Concussions, played by Will Smith. It was an exceptional movie. Watched it myself. It provides every single details from what it's like, what he did in real life, towards the movies. And they have very good comparisons, and it's a very good movie to see. Between 2008 and 2010, the bodies of 12 former professional football players were diagnosed by Amalu. 2012, we're just going to bring up some big name people and the biggest cases of CTE. On December 1st, 2012, Kansas City Chiefs linebacker Javon Belcher actually killed his girlfriend and drove to the Arrowhead Stadium the next morning and killed himself right in front of then general manager Scott Pioli and then head coach Roman Cannell. A year later, on behalf of the Belcher's minor daughter, the family lawyer filed a wrongful death lawsuit against the Kansas City Chiefs, alleging that the team deliberately ignored the warning signs of CTE, possibly leading to Belcher's suicide. The lawyer also hired a medical examiner to examine Belcher's brain for signs of CTE, and on September 29, 2014, so 2 years later prior to his death, it was confirmed that he was diagnosed with CTE. As of November of 2016, 90 of 94 former National Football League players were diagnosed under the post-mortem with CTE by Dr. Alex McKee, former Detroit Lions lineman and 8-time Pro Bowler Lou Creekmore, former Houston Oilers and Miami Dolphins linebacker John Grimsley, former Tampa Bay Buccaneers guard Tom McHale, former Cincinnati Bengals wide receiver Chris Henry, former Chicago Bears safety Dave Dwelson, and former New England Patriots and Philadelphia Eagles running back Kevin Turner. All been diagnosed with post-mortem with CTE. Other football players included Buffalo Bills star running back Cookie Gilchrist and Wally Hilgenberg. So these are players that played from probably like the 60s to 80s. That's why their names are not like known now. The closest name of this century would be Chris Henry. He died in 2007 from a head accident late at night. An autopsy conducted by Dr. McKee in 2010 on the brain of Owen Thomas, a 21-year-old junior lineman at the University of Pennsylvania, who died of suicide, showed early stages of CTE, making him the second youngest person to be diagnosed with the condition. Thomas was an amateur football player who diagnosed with CTE. So young players can be diagnosed with CTE or obviously concussions in general. Concussions can just come at the early stage, from JFL, Pee Wee, all of it. So that's why football players nowadays are dying at a young age, and they are retiring at a young age because they don't want to deal with the risk of CTE or concussions in general. Even though players love to hit people, that's the name of the game. They treat football as their main job. Obviously, it's always safe to play the retirement stage early. They don't want themselves or their families to be stuck with the risk of CTE. So, like I said earlier, it can even happen in high school. So, like this right here, in October 2010, a 17-year-old Nathan Stiles of Spring Hill, Kansas, died hours after his high school homecoming football game. He took a hit that would be the final straw in a series of concussive and concussive blows in the head for the high schooler. So, like I said, it's always safe to teach young players the forms of tackling in order to risk not stopping CTE, because it can come at a very young age. just like how 17-year-old Nikki Styles did.